Well, 2 years after it was first announced, the Eastern Cape Health Department has launched an acute mental health unit in Port Elizabeth. The tender process for the work had to be restarted after irregularities. The new unit at the Provincial Hospital will go some way in addressing deficiencies in mental health care that were red flagged by the health ombudsman earlier in the year. Jayed-Leigh is our reporter in Port Elizabeth tonight. Jayed-Leigh, good evening to you. What kind of services is this new unit going to provide?
A very good evening to you, Stephen, and good evening to the viewers. Well, just walking in, the new facility, it's clear to see that the patients are really going to get the help that they need. There's going to be psychologists on site as well. There's 40 beds that are going to cater to patients that are going to walk into PE Provincial, 18 on the female wing, another 18 on the male wing, and then there will be 4 for patients who need to be secluded and away from the rest of the patients. But I'm also told there's going to be several doctors on site, and they will be staying with the patients, psychologists, psychiatrists also, so that if patients do need to speak to anyone during the course of the evening, they will be on site. As it stands, the beds have just been delivered to the hospital. Patients have not yet occupied the space, Stephen. But just speaking to the MEC this morning, she did say to me they want to, speed up the process and ensure that patients from Livingston Hospital here in Port Elizabeth and Dora and Ginza Hospital and several other, mental facilities here in the Eastern Cape can come to PE Provincial and also be assisted. And like you said, the ombudsman flagging, the Tower Hospital, and I suppose some of the patients from Tower Hospital in Fort Beaufort will also be coming to Port Elizabeth and going to Provincial Hospital.
There was a delay in opening this unit. What actually happened?
Yes, there was a delay. There were talks around actually finishing the unit. As it stands now, like I said, the beds have just arrived now. There's still several other facilities that they're going to incorporate there. I know when I spoke to one of the doctors on site as well, they're saying that they want to also build some sense of camaraderie for patients that come into the hospital. As you know, Stephen, having a mental, disease does not take away from anyone. And the doctors on site were also saying that there are normal people from the streets that are just going through certain things in life that have triggered or, that have incapacitated them. Sometimes they have problems at work, sometimes in their relationships. And these are people that are just coming to the hospital to try and find themselves again. So there's going to be several activities also at the hospital to try and build some sort of camaraderie amongst the patients to talk about their experiences as well.
Jayed-Leigh, thank you very much indeed. Our correspondent in Port Elizabeth.